Doctors use it to some degree. Secretaries use it a lot more than even doctors do. But make sure that you're using common acronyms. Make sure you're using common abbreviations. Make sure you're using things that people other than you know. Because it's like Klingon. It's okay to talk Klingon to other people that talk Klingon. But if you're talking Klingon to somebody that doesn't talk Klingon, good luck with that. There's a whole lot of miscommunication going on there, or people just staring like puppies. Okay. Symbols, that's another thing. Make sure you use an accepted symbol. There's some that we use commonly. There's some that we use very commonly, such as symbols or letters like the letter C with the line over it. If you're writing a report, the letter C with the line over it means with. The letter S with a line over it means without. I use that one all the time. And I find myself even doing it like writing letters to people. I'll write like an S, well, I couldn't do this without you. And my mom's like, what does an S with a line over it mean? It means without. You don't know that. But that's a commonly held abbreviation. That's something that people see all the time. Or something that people use all the time. So, couple questions here. Which of the following components of a med term conveys its essential meaning? Which part is the essential meaning?
C.
C, the root word. Okay? That is where the root term comes from. And typically, and you'll see this on, maybe you'll see this, maybe you won't. Typically, those come from Latin or Greek. Okay? Those typically come from Latin or Greek. All right. Which prefixes can indicate what? Color, conditions, body part, or procedures?
B.
Okay. You said conditions. Anybody else?
Color.
Okay. Color? Okay. It is color. Remember, it's color, number, position, or direction. And what the whole purpose of a prefix is to point us towards something. Okay? So when we talk about a prefix, it's like cyanosis. It's, like you said, cirrhosis, yellowing of the skin due to liver problems, right? Okay. The plural form of the word bronchus is what? Is it bronchi, bronchus, bronchices, or bronchi?
D.
Bronchi. Okay? Alright, good deal. Good deal. The statement, the lungs are superior to the bladder, indicates that the lungs are closer to the head. Okay? We should know that simply from anatomy. Okay? But yes, that's good. Movement of the arm toward the midline is referred to as toward the midline. What is it? Adduction. Remember, ab means away from, ad means towards. Good, 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 good. Okay? A body part that lies closer to the midline when compared to another is considered to be medial. Yes, good. I like it. I like it. Considered to be medial. Blank is used to identify a body part that is on the belly side or anterior surface. Is it deep, superficial, dorsal, or ventral? Which one? Okay.
Surface.
Remember, we talked about this.
The belly.
Okay, deep means that something is what? Deep. Superficial means something's
On the outside.
on top or on the outside. Dorsal means something is where? On the back. Ventral means that something's on the belly. There you go. So it's D, ventral. Okay? So if you look at a dolphin has a small ventral fin and a large dorsal fin, just like sharks do. They have a very small, if they have one at all, it's a small posterior dorsal fin, or ventral fin, and that's just to help the tail navigate. The larger dorsal fin is what actually helps them cut the water. Okay? So you place the patient in semi-Fowler's position for transport. This means that the patient is what?
C.
C.
45 degrees.
Okay, 45-degree angle. Good, good, good. I like it. A laceration is located on the plantar surface That means it is on the
A. Sole.
sole of the foot. That's right. Because if you think about it, plantar fasciitis, which is a foot condition, has to do with the arch of the foot. Okay? When using abbreviations, acronyms, or symbols, an EMT should what? Be familiar with those used in his agency, use only those that are medically accepted,
D.
all of the above. And use them to shorten documentation. It helps to shorten documentation, but it only helps to shorten documentation when you're using approved abbreviations, acronyms, and symbols. Like I said, if you're just making your own stuff up, not only you're going to have to rewrite it, but you're also going to have to rewrite it, and hopefully you rewrite it gets corrected before you end up in court with it. Because trying to explain something that only you know to a bunch of people who don't care what you know, they just want to know what you have on a piece of paper, is not a very easy task, and it's not one that you want to be assigned to. Okay? All right. Y'all have any questions about any of that? Yes, no, maybe so? All right, good.